Welcome to Erica's Dry Mani and Pedi. I'm your host, Erica, and today we have a special guest, Dr. Dolford. She specializes in wound care and diabetic foot care. You guys, she is going to dive deep with us into corns. What is a corn? Guess what? Stick around, you're gonna learn a lot. She's amazing. All right, Dr. H, I'm so glad to have you here, and I'm just gonna jump into the big question is what is the biggest misunderstanding about corns?
Oh my goodness. So, corns, a lot of people feel like I have to be a bathroom surgeon, like I have to use a sharp instrument, a razor blade, or a scalpel. People get a hold of scalpels from Amazon and they try to trim these things up. That's the biggest misconception, that the only way I can get rid of my corn is if I perform some type of surgery. Misconception number one. Number two, corn pads. I absolutely hate corn pads. Yes, they soften the skin and they do all of the things that they say they will do, but they do so much more, meaning they don't have a gauge on them. They don't know how far to go. And so I end up seeing a lot of individuals that have tried corn pads to remove their corn and end up with a wound on their toe. It
So what
actually
exactly
erodes.
what is actually a corn pad that could lead to a wound? Can you tell us a little more about what that is?
So, you know how you see over the counter specific corn remover or corn pad or corn eraser. And so it gives you steps. It has like a little inner pad and then a pad that protects the inner pad. The first pad that goes down is usually a salicylic acid, aspirin in a pad. And that is a great medicine or tool to soften dead tissue or corn or a hard area like that. So it works good in that sense. But what happens, we leave it on 3, 4 days. You have your shoes on, you have showers, and you don't take it off and look at what's going on. So then when they remove that corn pad, they're removing layers of skin, and usually there's a hole into the good skin. And so I really, really try to get people to steer away from that.
And that's what you mean when you said earlier about the gauge, that you might have a corn like the size of like a nib, right? The tip of the pen, but the pad might be the size of a dime. So all that live tissue that's healthy is
It's
has the acid on it and is breaking it down, and then you end up with a dime size wound.
that part exactly. Does that make
Great.
sense?
It does. And that's
So, on the contrary, when you have a professional that's working on your corn, they have great visualization to see, okay, this is corn, this is not corn. We should continue or we should stop here at what depth, if that makes sense.
in your professional opinion, like you've seen people who've been treated by other doctors, you've seen patients who have seen a nail tech. Do you believe that nail techs that removing or like reducing corns is within their scope?
Absolutely.
Tell me more.
I liken it to a hairstylist where the client may have dandruff or seborrheic dermatitis, like a thick scaling on the scalp. The hairstylist knows how much of that to remove to where you're at live or viable tissue. So, a nail tech with a corn, you have this pronounced collection of skin, because that's what a corn is, a bunch of keratinized skin cells that are packed together in a concentrated center. Does that make sense?
And that's also like why we see them a lot where those pressure points are in shoes, right? Like where your shoes are rubbing because that
Yeah.
friction.
Friction. So when you see a corn, think friction. There's constant pressure on the foot somewhere. So, a lot of times people that we see will have hammer toes where the tendons underneath the toes have drawn them up, like so. And so you will tend to see corns on the top of the knuckles of the toes. Um, the fifth toe, the outside aspect of the fifth toe, the pinky toe or the baby toe, that friction's in our shoes all the time. So we see corns there a lot. You'll even see the toenail change color there because that is always a point of insult and injury. So, pressure. Think pressure whenever you think of a corn.
Now, talking about like having the corns on top of the toes versus in between the toes, like the webbing of the toes, and then the heel, I know there's a soft corn and there's a hard corn.
Hmm.
Do we remove them or reduce them the same way? And what is their difference?
So, hard corns are keratinized, they are very defined. And this is totally in the scope of a nail tech, I feel, in my professional experience.
The
Because this
doctor
is
told us, bring them on, corns. We got you. All
absolutely
right,
my
maybe
nail techs
you
in
know
my
what you're doing.
spa.
She's gonna teach us how to do it.
Yep, they reduce them all of the time. Hard corns are pronounced keratinized cells that sit up on top of the skin, and you can easily visualize that. Soft
Kind of
corns,
like they kind of look like a little pimple, right? Where there's like you can see this like little speck. Hmm.
soft corns tend to be newer. Those are corns that will become hard corns if we don't get the pressure off. So typically, soft corns don't require a lot of reduction. You kind of clean up that area, maybe a little fine tune reduction. Tell them, hey, let's wear a wider shoe, offload the pressure. They usually take care of themselves. Hard corns, on the contrary, you have to get the pressure off, but a lot of times you have to reduce that keratin plug. It's almost like a keratin plug. You have to reduce that in order to heal the area.
And why? How does that feel? Can you like express to somebody who's like, I don't know if this is a corn, I don't know if this is a wart. What is that feeling when you have this little keratin plug on your foot?
Well, I mean, it's hard. When you palpate it or rub across it with your finger, you feel
Uh-huh.
that hard skin there. Now, plantar warts can present the same way, but typically plantar warts, if that's what you were referring to, they are usually on the plantar aspect of the foot, the bottom of the foot. Corns we usually see on top of the toes, on the side of the toe, or in between the toes. Now, there's no rule book that says, hey, a plantar wart can't grow here or a corn can't grow there. But usually, while you're learning the process of differentiating between the two, location is going to give you most of the information about what you're dealing with.
Now, will you tell us a little more about what those differences are as like we're training our minds to like be able to recognize a corn and how that's different than a wart because we know we can't work on a wart. If we
Exactly.
know that corns are usually on top or in between, can you tell us
Hmm.
more if we do think something like that looks like a corn, it's on a metatarsal support arch, excuse me, a metatarsal arch. How am I then going to look and determine should I work on this as a nail tech or should I not?
Okay. So, comfort level, skill set. You are as comfortable as your skill set allows you to be. So, things that you
Ooh.
haven't experienced, get help with
Mhm.
it. Let your doctor look at this before we work on it. Now, a trick to it, a plantar wart can be underneath a corn. You can have a corn on top of a plantar wart. And then you can remove the top of the corn and then see that the bottom of this thing has blood vessels. That's usually what plant shows you that it's a plantar wart. So when you see those
Okay.
little blood vessels down there, then you know, hey, abate, this is a plantar wart. You need to see a medical professional. Um, and plantar warts are caused by a virus, human papilloma virus, HPV. That is the cause of a plantar wart. They are highly contagious. So we're using personal protective equipment when we're working with our clients or our patients. So let's say you've removed the top of the corn and you think there's something going on down in the center of it. You stop there. You make sure you clean your implements,
Mhm.
sterilize them if you practice that in your area, but just abate. It's not. like the patient's going to be bleeding or spraying human papillomavirus all over your clinic or your spa. Does that make sense?
It does. I want to dig, no pun intended, I want to dig a little deeper into that corn because, as you said, you can get your skill set, you can advance your knowledge in foot care. However, there's still going to be that application when you're sitting there with a client and they're in desperation, like, help me, my foot hurts. And then you start to use your bits and work on it. And sometimes I've noticed with removing corn, it hurts more before it feels better. Would you validate that that is true because you're digging into that plug and
That
that
is
pressure is
correct.
going in?
That is correct. And I think if we explain to the individual what we're doing. So let's say I usually don't say I'm digging out the center of your corn.
Words matter.
Yeah.
A little more finesse.
I usually explain to them that I'm going to use a specialty bit to remove the
Mhm.
top of your corn. And when I remove the top of your corn, I can see the center of where the corn is located. And I use the bit to tap down around and under the corn so that that hard center that causes you discomfort comes out.
Mhm.
So typically calluses occur on the plantar aspect of the foot. Diabetics, we see calluses a lot under the metatarsal head of the first toe, the great toe. Um,
Mhm.
and if you look at in comparison, these two pictures, they're both under the great toe. One is kind of to the side, the lateral aspect of the toe, and the other one is under the plantar aspect where they walk back and forth. Calluses are so important to understand in diabetics because if we don't reduce the callus adds constant pressure from the outside. The bone adds constant pressure from the inside. So once the patient bleeds into the callus, so when you look at it, you see a bloody spot in the callus, that is a diabetic foot ulcer. Once we, at this point, they have to see a medical professional, but once we debride that callus away sharply, they have a diabetic ulcer. So it's imperative to get the pressure off.
Stop the interview. If you are so ready to level up your corn removal, go to Erica's ATA and check out our corn removal bits. You guys can do this too. And also use promo code CORN, CORN 20, corn 20, and get 20% savings. We want to see you be successful. Now let's get back into this interview. What if you don't remove all of it? Like if you're, oh, I'm a little nervous. I've kind of like, for lack of better words, like broken that top seal. I now see the exposed plug and I'm drilling in it, but my nerves are getting too far. What if I don't take it all out?
There's another opportunity. They follow up with you and you work. Anything you've done, just removing the top center is going to offer comfort. And so you may have to say to them, I'm going to have to see you back 2 to 4 weeks, and we try to work a little further each time. You always
Okay,
gauge by the patient's comfort level. If it's really uncomfortable, then we have to stop and re prepare them for what we're doing.
I love that. Now, on the flip side, for the person who might have been a little too aggressive, how do you know if you've gone too far? I've never done that before.
Hmm.
Gone too
So,
far.
if you're using efficient tools and bits, time, it shouldn't take 2 to 3 minutes to remove that plug. If you're working there and the patient starts to experience heat, you know that
Mhm.
that's too far. Let's stop and go at a different approach.
And when you're using our Erica's corn removal tools, what speed are you running at with your e-file?
So it depends on the thickness of the corn and the size of it, but between 14 to 16.
Oh, so not super fast.
Mm-mm, mm-mm.
The tool does the work for you and you just tap, tap, tap.
Does tap, 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 and it's out. Now, calluses, I have to go up higher, but corns, between 14 and 16 at most, and I get great results, especially when they're on a real bony prominence.
Mhm.
Patients tend to tolerate that a little bit better.
Do you think, I know a lot of our nail techs is they are getting people to send pictures. via social platform to better understand their condition, and can I work on this type of foot or condition? Is it a wart? Is it a corn? Is it hard to be able to tell the difference between a corn and a wart through a photo?
Sometimes it can because you can't always differentiate the center of a plantar wart. But
Okay.
plantar warts are usually painless. A corn that you're walking on is always causing pain.
Okay.
Plantar warts, on the contrary, they're usually not painful. So when I'm doing a foot exam and I see an area under the foot, I say, does this cause you any pain? And they say no. There's not any reason to work with it if it's not causing discomfort.
Are there any at-home remedies that people can do to combat the wart?
So when patients have warts, they see a medical professional. We usually do sharp debridement to unroof to remove the top of the plantar wart. And then I send them home with a compound salicylic acid and urea. This softens the skin and allows the salicylic acid to penetrate the base of the wart, and this usually kills it. They cover it with duct tape because it has to be occlusive in order to choke it out. That's what I call it.
Okay. And then also something I learned from you when I came and saw you down in the South is that like you gotta wash your bed sheets, your bathroom mat, your rugs if you're walking barefoot, right? Because it is
Hmm.
that contagious that you can just reintroduce the virus. Is
Infection,
that correct?
viral
That
infection.
you
Hmm.
can reintroduce that viral infection right after you've just got it taken care of,
You
correct?
can, yeah. And then worst case scenarios that don't respond to topical salicylic acid, they have to receive cryotherapy, which is like medical grade freezing.
Now, I also feel like I feel like in school they were talking about like the shape of a wart looks more like cauliflower or
Hmm.
broccoli,
Hmm.
whereas the corn is just more circular. Is there
That is
truth
correct.
behind that?
That's fact. That's correct. Hmm.
And you
Yep.
see like the little like dots in it, like the little bugs in the broccoli?
Yep. You do.
Yeah.
You really
I
do.
did learn something in nail school.
Look at there. Look at there.
Girl, you're all the things. And you make it look good.
Mm.
Because sometimes you can have all the things and it just don't look pretty anymore, right? You got the cupcake with like way too much icing and too many like the funky stuff, and you're like, it just looks like a sugar rush, but you're all of it. You recently sent over to my team that you had a client, excuse me, you had a patient who had hammer toes and there was a corn on top of her toes and she was scheduled for surgery. Can you just walk me through that journey and how our tools were able and techniques were able to help her cancel that surgery?
Absolutely. I mean, it was the most exciting thing. Prior to use of the tools, I wasn't certain we could get rid of corns. I thought, we could treat them and keep them comfortable, but continued insult to injury, they come back. So this patient had a very pronounced hammer toe, and the corn was very pronounced. Just a few days before each appointment, she would say, "Hey, I really had to get in this time. I'm in pain." And so after we started with the corn bed, I said, well, I can try to use these bits. It's probably going to be a little bit uncomfortable while we're doing this, but I think that you will have a whole lot of success afterwards. So we referred her to the orthosurgeon and he talked to her about tendon lengthening, and it's a minimally invasive surgery. You go in as an outpatient, they just release the tendon underneath the toe so that the toe could relax. But she was not a fan of surgery, so we used the corn bed. We brought her back 4 to 5 weeks. First thing she said when I sat down, whatever you did to my corn is gone. I don't have any more pain. And so I said, what about your follow up with the ortho? She said, I canceled the surgery. And so I've seen her at least 4 times since we used the corn bit on it. No more corn. Yep.
Like one and done, not even like there needed to be continuously, let me
Mm-mm,
see everything. It was
mm-mm,
literally like the
mm-mm.
solution that she didn't even need surgery.
Exactly. One and done.
Oh, one and done.
Yeah.
Now, So my question with that, that's obviously like life changing to
Hmm.
someone, and also just to know that they didn't have to go through that fear of surgeries and the complications that can happen. Do you think as nail technicians that we should charge for corn removal or just kind of bundle that into like a wellness care pedicure?
I
And
think
this
you
is
should
there's no
charge.
wrong and right. This is totally
Yeah.
your personal
So
feelings.
I think you should charge. So what we do in our clinic, you have your basic medical pedicure, and I know medical pedicures is not a thing for you all. So wellness, so it would be equal to y'all's wellness pedicure. So that is your basic implements. For an example, in our wellness pack, we have a long and lean that we use on the toes, and then we, of course, use a pedicure bit. Torch is our favorite in our clinic. So that means we don't pull any more implements as far as that pedicure is concerned. Now, if the patient has corns or calluses, we kind of add that together in the next step. So that would be a wellness two. So wellness one would be what I explained to start with. Wellness two means I've used all of my wellness implements, but I've got to pull other implements to treat further conditions. Every time you
Okay.
pull an additional implement, that should incur an upcharge.
And
Mm-hmm.
I am hoping too the knowledge, right? That if you are jumping into wanting to know more about corns or different foot conditions, is that education for the individual, even though it's
Mm-hmm.
not required by our state since we're not cutting live tissue, that price with your implement is
Mm-hmm.
also covering the cost of your knowledge and
Exactly.
training.
Exactly.
And it's also like what I like about that too, Dr. Hillary, is that it's a choice, right? Like
Mm-hmm.
you booked the wellness one. There's this
Mm-hmm.
additional stuff we can do, and that's a choice that we are giving the client where they can deny and say, okay, this is the best that I can do.
Mm-hmm.
Or it doesn't have to feel salesy, like, oh, I feel bad for charging them. That it's a
Mm-hmm.
choice.
Mm-hmm. Yeah. And then, they come into you as the expert for recommendations. And so when you're
Mhm.
recommending, this is what you need, this is the frequency that you need, they get used to that and they trust that you're providing them with what service is best for their foot health.
That's fantastic. What would you tell
Mm-hmm.
a new nail tech who's like watching this and like really curious to be like, hey, I'm seeing these. I know that they're painful. I want to help my client. What do you think those next actionable steps should be for the nail technician?
Absolutely advanced training, hands on, advanced skill set so that you're comfortable. When you become comfortable with such things, it grows your business. It expands what you're able to do for your client set. So, advanced training would be number one. And because the thing is this, I trained as a nurse to nursing doctor. And with every skill set, there was a checkoff. And that checkoff made me so comfortable. So I started with a dummy and I went through all my steps effortlessly with the dummy. And then I moved up to a human with my preceptor or my proctor standing right there. And that gave me the confidence to do any and all things nursing wise. So I think the same thing should apply for nail techs or any service profession where we're treating people. You need that hands on training, that advanced watching and learning skill set, but somebody there to show you through each step.
Yeah, it's worth its weight in gold, especially
Hmm.
when you're giving these services to a diabetic or an elderly client where it's like, hey, I can't go too far, and you really are
Hmm.
entrusting me with the health and care of your foot. Like that's
Absolutely.
important, and it's a
Hmm.
privilege. It's a privilege that I can stay within my scope and help people,
Hmm.
and allow people who have significant significant. I want to say stuff, I guess I don't know, like significant what's the word? Significant
Issues,
foot
issues.
conditions. Yeah,
Hmm.
significant foot issues that they can come to you. And when it gets to
Hmm.
that point, is like the nail tech is the frontline worker where we have eyes to see when something's progressing, and we can do a very soft introduction to say like, hey, this is now gone past where my skills inability and
Hmm.
training lie, but here's this new introduction. I trust this person. And it's really a relationship, isn't it, Dr. Hillary?
It
It's not
is.
like nail tech against the doctor. It's really this, we can work together and really help people and their overall foot care goal and
Hmm.
wellness.
And what it ends up being is limb salvage. You're helping them keep their appendages, keep their feet, keep their extremities.
How do you deter corns from forming?
Keep the pressure off. Wide toe box shoes. If you're an individual that has hammer toes, you definitely need wide toe box shoes. If you're diabetic, all of this fashion and pointed toe shoes gets you into a lot of trouble. I have a diabetic patient that I've cared for the length of my NP career. And
Mhm.
he shares his story openly. He's all over my website, but he now only has three toes. And one of the stories he tells is that he was bent over wearing pointed toe Louis Vuitton. That was his choice of shoes. And he even tells the story. We were Black Friday shopping, and he saw me across the parking lot, and he yelled, and he came running over. And the first thing I said was, "I know you don't have on pointed toe boots." And so, saying all that to say this, shoes make a difference. He ended up with a lot of pressure injuries and ended up, having several amputations. Um, we're down to three toes, but now we get it, you know. So there are some really extreme cases of people that have gotten into trouble with just shoes. I had a patient one time, diabetic. It took us about a year to heal a wound on her foot. She wanted to wear shoes, dress shoes to her daughter's wedding. She wore the shoes, she danced all night, ended up with an amputation. So I know that I see the extreme of what happens with foot health. But down the road, we want to take care of people across all spans of the generation. So we try to, teach them early on good shoes from the beginning.
Yeah, because
Um,
some of your clients like that, their feet are hurting. Like, how does that affect their overall quality of life when they get to that point and they're losing limbs and they hurt and they're in constant pain?
yeah, it attributes to death. There are I mean, the data is there that shows once a diabetic has an amputation, 5 to 7 years they're likely to have another, and 5 to 7 years after that they're likely not to be here. So it really kills the quality of life.
Gotta have a sad moment for that for a moment.
I know, it's hard.
Well, and
It's
your feet,
hard.
like overall, when your feet hurt, even like being young and fun, when your feet hurt and you've been standing too long, even if you're wearing like the right shoes, like your
Hmm.
feet really dictate your mood.
It does. It does. Hmm.
Yeah, like very, very, very much. So taking care of and actually learning foot care wellness when you're young
Hmm.
and wearing shoes. Like there could be those times for special occasions for the pointy shoes, but making that a lifestyle and your go-to is like there's long-term repercussions for those decisions that will overall
Yeah.
affect, do you want to go on a walk with your granddaughter someday? Or are you in too much
Exactly.
pain and you're not able, or you have an amputation that you're actually wheelchairing it next to them? And I don't want to be a Debbie Downer, but I think it is really important that we think about our future
Hmm.
selves and how we're caring and how we overall see wellness in foot care.
I say pretty shoes are for pictures.
There you go. I like that. Pretty shoes are for pictures, but practical
For
shoes are for
pictures.
people who want to enjoy life.
Really good shoes, wide toe boxes, keeping the pressure off, absorbing the shock when you're walking and working out. That's the biggest thing you can do to prevent. There are people that have really crowded toes, and they make these silicone pads that you can place in between your toes or toe spacers, and that helps to reduce corners as well.
Now tell me this. Like I know there is like they're not the prettiest thing, but tell me what you think about, are they called the
Focus.
hookahs? Hokas. Tell
Hookah,
me about
hookah,
what your thoughts are on the
hookah,
hokas.
hookah, something else. You know that, right?
I do know that.
All right, so Hoka is the most recommended shoe for individuals that suffer from plantar fasciitis. The way that the soles are contoured and the thickness of the soles absorbs so much of the shock that keeps the pain from being on the fascia of the feet. So they are the number one choice with the Orthopedic Society. New Balance are great shoes for persons with wider feet because New Balances automatically come with wide toe boxes.
We have the barefoot movement that's all about minimizing any kind of shock, right? Because it wants to build
Hmm.
that strength and stability. And then on the opposite side, we have shoes that offer a lot of padding to prevent pain. What side of the
Hmm.
spectrum should we be strengthening the foot so that we're not in pain, or do we try to get rid of the pain and then go back to strengthening, or you do you? Like, what does that whole movement look like, and what side of it are you on?
So, well, I'm on the side of pressure analysis. Pressure analysis speaks the truth. So I've not compared the study of the barefoot shoes pressure analysis as opposed to Hoka. I would like to see that in a comparison, and that um, I feel offloading the pressure is the biggest concern, the biggest benefit we could do for the feet. Um,
Okay.
I need to do a little more studying with the barefoot movement because I want to see, as far as arch support, what that's like for a lot of people, especially those people that have those really high arches. The thing is, Erica, shoes have to be individualized. You know, you can't just pull a size 8.5 and say, this is going to work for you, and you. You have to look at all the contouring of the feet. That's why it's so imperative that diabetics wear shoes that are customized for their feet and not the foot
Yeah.
for the shoe. So it
And
is
by real
really.
quick, so do you mean real quick? Do you mean when you say customize, like orthopedics?
Yes, yes. So actually, what happens in
Okay.
the diabetic world, they go step into a pressure mold and they make the orthotic for the shoe according to that foot. And then the
Okay.
orthotist looks at the contouring of their feet in that orthotic and in the shoe to see if there's any pressure anywhere, any friction anywhere. So shoes really should be individualized that way per person. And so it's kind of like when you find what shoe works for you, you tend to see people stick with that shoe all the time. But to say across the board everybody should be in this barefoot movement, or across the board everybody should be in Hokas. One issue I see with my patients in Hokas, yeah, it absorbs a lot of the shock, but the rocker aspect of the shoe sometimes aggravates their sciatica or lower back pain. So it's real hard to put everybody in one box and say, hey, this is a shoe that fixes it all.
Yeah. Your foot care goals and what conditions you already have to get to where you want to be. I hear that.
Hmm.
I appreciate that too, because so often we want to say, this is the one band-aid that'll fix everything. And
Yeah,
very often it's not.
it's
So
not.
just recapping for our nail techs out there, if you are on the edge of, should I start doing this corn removal? What's the difference between the corn or the wart? What
Hmm.
is the quick rundown, Dr. Hillary, for that nail tech who's been studying, they're ready? What should they look for, and what advice are you going to give them? No pressure.
And number one, location. What is the location of corns typically, and what is the locations of warts typically? They are called plantar warts for a reason. They usually occur on the bottom aspect of the foot. So if I were a new nail tech and I had done some advanced training and starting to feel comfortable in my skill set, I would only start with corns on the top of the toes because I
Okay.
know 95% of the time this is a true corn.
Okay.
Does that make sense?
Yes, ma'am.
Maybe later, as my skill set advances, when I see something on the plantar aspect of the foot, if I'm not certain if it's a corn because the location is off, then we're looking at shape. Is this perfectly round? Does it have a defined center? Or does it look like little cauliflower?
Yes.
Don't be a hero. If you're not sure, call in the big guns. It's that simple. And your client will respect that more than anything.
Hmm.
Some people, like you say, they're like, hey, just fix it. I trust you. You can do anything. But at the same time, you have to work within your scope and your comfort level. You know,
Yeah.
a lot of times we limit our scope because we don't have the skill set to go as far as our scope goes. Does that make sense?
Yeah.
So, go within your skill set, go within your comfort level. That is where I would start.
Okay.
Calluses, we hadn't talked a whole lot about calluses, but they are very similar to corns in that they are caused by constant friction and shearing. Um, Usually, calluses are much larger than corns. So you'll know right off the bat, shape and size. Calluses are usually round and they're usually over bony prominences on the bottom of the foot. You
Okay.
can
Because
get
they're taking that
calluses
impact, that pressure,
that constant
constantly
impact and
hitting that
pressure.
bony
Yeah.
spot.
Yeah. Yeah.
Yeah.
And diabetics under the great toe, the great toe rubs back and forth in the shoe. And so you can see it there. You can have a callus with a corn underneath the callus. Um, you don't really get into a lot of trouble there. You just, debride away most of the thicker callus skin. And then if you see that localized center, then you know to go in and get
Mhm.
out the corn. Um, but those are a couple of the tips right off the bat that I would work with. Um, there aren't a lot of medical professionals that have the time to treat corns and time to treat calluses. They have to work on the bigger problems. And so, having nail techs in the area that specialize in this and are comfortable in this helps us treat more of the population. So, that's why I highly encourage nail techs to look into this type of training.
I think what's really important too is that we are aware of as nail technicians is to look for education that's going to bring you knowledge, knowing that's not going to change what you can do. What I
Hmm.
mean by that is if you're calling yourself a medical pedicurist, I want to caution you because we are still in the wellness aesthetics world, not the medical. The big line there is live tissue, and that's not what we're doing. We are not cutting that live tissue. We are just debulking, as Dr.
Hmm.
Hillary said, the plug. We are just
Hmm.
debulking. That's what we're doing. Like,
Hmm.
so it actually is removing that corn, but we're not hitting that live tissue. And I think that's what's really important, that we're not misleading to our communities. And we're also staying within our scope to protect ourselves. Because anytime as a nail technician, I'm saying the word medical or treatment, we are now not within our scope and it's very misleading. But we can offer
Hmm.
solutions, we can do reductions, and we can work on the overall care and foot care goals. And I think that's what's really empowering, and that's where you build confidence. Is we're not trying to
Hmm.
enter a different world, we're working with the medical world because they are working on more serious conditions, but we're here saying, hey, we can handle some of these things, but it is going to require more education. But that
Hmm.
education doesn't change our ability and our scope to get into verbiage or
Hmm.
clinical stuff that we should avoid.
Exactly.
Dr. Hillary, I'm just going to open up the end of this conversation of what have I forgotten or what would you love to share with the nail community?
Well, Erica, I think it has been a great discussion today. There are so many questions, there are so many gray areas, and I am just so excited for the nail community that you exist. I met you on a quest for education. There was things I wanted to perfect with my practice that you were able to teach me as far as dry pedicuring was concerned, and that has added to my business. We're all in business, and yeah, we all want and need to make money to survive, but this
Yes, ma'am.
goes far beyond what the almighty dollar can do. We both love taking care of people, and this is a great opportunity that you're providing your community for growth and education.
Thank you for your knowledge. Thank you for your love for this industry, and thank you for caring for so many people in the state of South Carolina.
Absolutely. Talk soon.
Isn't Dr. Hillery amazing? I love that she is cheering for us as the nail tech. If you want to see more awesome interviews like this, see tools, techniques, and education, you know the drill. Subscribe, like, and you know what? Show a friend. Maybe you know somebody who has a corn and they need this video to find their nail tech. I'll see you guys in the next video.